Hello, everybody. Welcome back to the Science Dispatch podcast, episode 39. I am your host, Cameron English, joined, as I usually am, by Dr. Chuck Dinerstein, Director of Medicine at the American Council on Science and Health. Chuck, what's going on today? How are you?
It's a beautiful day in the neighborhood. Nice to hear your voice again after a week's break.
Yeah, that's right. You were sitting on the beach sipping Mai Tais from what I heard. How was that?
That was very lovely. Well, I was down in what the doctors call God's waiting room, Florida.
I've never heard that, but it seems appropriate. That's great. Well, you're not in God's waiting room, hopefully, and
Nope.
We're here to talk about a little bit of science. We have two stories, as we usually have. The first one is an article by our colleague, Dr. Henry Miller, called "Do Masks Prevent COVID?" Spoiler alert, of course they do. And then next up, we've got a story from Chuck called "The Misinformation About Misinformation," which, as the headline subtly lets on, the story is about misinformation. So we'll get to that in a second. First up, though, Chuck, give me your insight on the story, mask preventing COVID and so forth. What do you take away from Henry's analysis? Let's start there.
Well, I think that the Cochrane people tried to divide the baby and tried to find the right words to use to say that they could not present any evidence that was sufficiently certain that they could make a clear statement about whether masks prevented or diminished the infections during the COVID pandemic. And it was certainly nuanced enough that you actually had to read what they wrote to get a full sense of where they were going. So that, from my point of view, that's the largest take-home message of all, is that whenever you have the opportunity, read the primary document. Do not simply rely on the interpretation of others. And masks, like any number of other things that were done during the pandemic, have come in for a lot of criticism, especially among the people who are using hindsight, which is always accurate in terms of that. I think basically what Cochrane found was that there was not sufficient evidence to make a statement one way or the other about how effective masks were, and that Henry tried to bring out some of those points in his discussion, and at the same time talk about the journalists that were making hay by ignoring the nuance and going for the political.
Okay, that's a good summary, good introduction. And if people aren't aware, you're talking about the Cochrane Collaboration, which is a really well-known international coalition group, working group, whatever you want to call it, of experts on various topics. And they assemble all the literature on a given topic, say masks, for example, or vaccines or what have you. And then they try to summarize it for everybody, policymakers, the general public. And this was one such review that they did on masking. They've done a couple now, I believe.
Yes, and one of the hallmarks of a Cochrane review is that they put certainty estimates on the studies that they look at and at their overall conclusions. They don't just say we think this, we think that. They put it, certainly they put the nuance of certainty into their recommendations, which is, I think, a great thing.
It's very helpful, and if anyone ever takes the time to read these, they are very nuanced. They're very extensive, and what I really like, and not all reviews do this, they explain what different studies found, and then they analyze why they may have found that. And it's so helpful because in many cases, you have to not just look at a review, you have to go look at the literature they reviewed to figure out what happened. And Cochrane goes out of their way to explain this to people. So I found that helpful. Just generally, and this is a little bit of gentle criticism, and full disclosure, Dr. Miller knows I'm saying this. I invited him to join us. He wasn't able to because of a scheduling conflict. But I found a couple of things in his story a little bit challenging, and I think I would have put it differently. The first thing that he says in here at the top of the story is he says the absence of evidence is not evidence of absence. That's certainly true. There are no randomized controlled trials that show that I love my wife more than any other woman in the world, but that is very clearly true, and I could demonstrate that pretty easily, right? So his statement is generally correct, but on a policy discussion like this, I find that a little troubling that in an article where he's purporting to say, of course masks work, the very first paragraph is, well, even if there's an absence of evidence, that doesn't mean they don't work. And so maybe that's the first thing we could talk about, Chuck, is just the way this is framed. And it's not just Dr. Miller. A lot of people have discussed masking in this context, so you're confronted with the literature on the subject. And then you go, well, despite what all that says, let me explain why masking is still effective for X and Y reasons. So give me your perspective on that, because I know we have slightly different takes on this. So tell me what you think.
Well, I'm gonna agree with you on the fact that the absence of evidence is not evidence of absence, is a variation on an abundance of caution. That it can be used for much mischief one way or the other. So I'll agree with you about that. My whole take on this conversation about masks and lockdowns goes in a different direction. And the direction I take is that you have to look at these decisions that were made in the time frame that they were made. You can't look at them now and come to necessarily to the same conclusions, nor might we come to the same conclusions today. Masks have been around ever since we discovered that washing our hands in the operating room was a good idea, which is maybe 100 years old in terms of being carried out. And I think at that point, masks came along for the ride, and we'd have to go look for some study from 1910 to show some efficacy there. And I don't think that they were necessarily the case, but they've been a common tool, and they have common sense to it. If you can put a protective barrier between your airborne particles and the rest of the world, then you would think that it's going to diminish the spread of an infection. So I think that at the time that masks were being pushed to the greatest degree, we didn't have any other good options. And so we fell back on what we felt had worked for the last several decades, which was masks. So I don't fault the use of masks at that point. At this point, I don't believe that masks have any great value at this point because of a variety of changes in the pandemic. But I will tell you, I was on a plane today and there was 10 or 15 people wearing masks. Didn't bother me. That's, they're right. I think of all places, a plane where the air turns over every minute or two is pretty safe, but they that gave them greater safety. All good.
Yeah, that's totally fine. I don't have a problem with people wearing them. Of course that, take whatever precautions you want to protect yourself. And we should also probably stipulate that a lot of these studies were performed during past flu seasons, and they're performed in different contexts that really don't really match the general public masking when they're, at the grocery store, So for example, a physician that works with infectious patients, as Chuck was sort of just alluding to, someone who's sick with some kind of an infectious disease, it probably makes sense to wear a mask in that setting, especially if you're in a hospital room or something, right? It's really easy to transmit stuff back and forth.
If somebody comes in with tuberculosis, I want them to be wearing a mask. You don't want them to wear a mask, then you can spend your time with them. But, in that situation, I think that, there's clearly situations where it makes a difference. And when we have these knockdown, drag-out fights over the dinner table with my friends about some of the things, I say, you know what? If you feel that strongly about masks, then the next time you have an operation, make sure your surgeon doesn't wear one. That's fine. It'll be fine with us. It's there to protect you, not to protect us. So, I think that the big take-home message in a lot of this Cochrane data is that we didn't have any great compliance information. People were not wearing masks all the time. They don't wear the mask properly. I mean, think back about all the people that I saw, and these are in healthcare settings, with the mask below their nose. What are they thinking? Unless they're not breathing through their nose. I don't know that we're ever going to get a good study to show that in the real world, masks make a difference. We may be able to show that in the laboratory and go from there. But in terms of the COVID pandemic, I think that we should have a little bit more, give the people that were making the decisions a little slack. We may think that it was probably excessive. It certainly is excessive in hindsight for a lot of people. But at the time that those decisions were made, people were dying in large numbers. The other take home I get from looking at some of the Cochrane data is that we may be looking at a small effect that we're not going to be able to see readily in population data. But as one of the people that Dr. Miller quotes points out, a small effect in an exponential infection can become a big effect over time.
Yeah, there's a lot we could say, and I think we could really get into the weeds on some of this. There were just some more general things that.
What else bothered you about it?
Well, yeah. I mean, that's what I'm getting, and I'm trying to be gentle here because it's really easy to get behind a microphone or type up an article and talk about how stupid or how evil somebody is. And I am very tempted to do that often. Don't get me wrong. I'm not trying to say that I'm high and mighty here, but I did find there's some inconsistencies in how we talk about this research. I mentioned the absence of evidence thing, So if someone was critical of vaccines, for example, and they said, well, an absence of evidence that vaccines are harmful doesn't mean that vaccines aren't harmful, right? I mean,
yes.
If the argument starts out that way, we're not going to take that person seriously. And I think rightly so, because the whole point in science is we're arguing over empirical data. So that was the first thing. The second thing is that I remember when some of these studies that Cochrane looked at, I remember when they came out in the last 2 or 3 years, and they were just as deficient then as they are now. But the same people who are discounting the Cochrane review today are the people who were defending these individual studies. So everyone's heard of the CDC masking study at the hair salon, the clinical trial that was done in Bangladesh that was done almost entirely in open air areas. So It has a little relevance to indoor masking. The Dan mask study that came out at the very beginning of the pandemic, which showed that people that were wearing a mask, they weren't protected I forget the exact metric, Chuck, but it was something like at 50% below the risk that a non-masked person would face or something like that. But it was notable because it showed that masking didn't have a very significant effect. And when the study came out, people said, well, they didn't look at source control data, but they weren't looking at people who were sick and wearing a mask. So therefore, we can ignore the results of this study, more or less. But that same standard wasn't applied to other, some of these ecologic studies that were done that didn't have very good controls in place, probably because you can't really have them in a study like that. But all I'm getting at here is there were differing standards employed depending on what the study said and who did the study and how the results were used after the fact. And so that was what I found really frustrating. That I still find frustrating is that just depending on what you need a particular paper to say, you can adjust what you're saying about it. So I'll stop. But what are your thoughts on that?
The first part when you talk about mask versus vaccines, and when you're talking about a risk from a vaccine versus the risk from a mask, that automatically gives you a different sense of absence of evidence of absence. When you're concerned about a risk, the standard's got to be higher. I think we can all agree to that. When you're talking about masks, which are being used to help, then you get into that, well, it couldn't hurt point of view. The other piece that I think is important to talk about is that, as you point out, these studies were done in a lot of different controlled, uncontrolled situations, not all necessarily replicating the times when we're concerned about infection. And I think the problem for the policymakers is that it's very difficult to promulgate general rules for how we might behave. There's probably zero value in wearing a mask at home because you're going to become infected by your family. You have a little kid. I know I had little kids. I have a grandchild. They bring it home. And mask will not save you in the setting of what goes on in the house. Maybe a mask will make a difference when you're out and about in tight public transportation, like the subway. Okay. Probably doesn't make much difference when you're at the beach. But how do you put that into a format that most people can understand and work with? And so I think that what happens is that the policymakers don't do nuance well either. And so they just make these blanket rules. You have to wear your mask. You have to be 6 feet apart because they're not able to spend any time looking at specific situations and making more specific recommendations, because most of the time people are not going to spend their time looking at them. Does that make sense?
It makes perfect sense. And I think, and we've talked about this before on this show, I think there's value in acknowledging uncertainty. I think there's some pretty good research from communications in science and more generally that if you acknowledge uncertainty in your evidence, it builds people's trust in you. So I think the CDC and Dr. Fauci and all of the figureheads, if you will, or the public faces of the policy response to COVID screwed up in this sense, in that they weren't willing to say, the evidence really isn't very good on this. We are recommending this as a precaution. Like the example you gave earlier, a very small effect might not show up in a population level study, but multiplied by 330 million people, it probably makes some sort of a difference, So, and maybe the wording of that could be adjusted. But I think if that were the messaging from the very beginning, this discussion we're having as a society about masks would be very different. It wouldn't be so dramatic. It wouldn't be nearly as politicized. But I think uncertainty makes people uncomfortable, especially when you are the face of a government's response to something. Like to get up in front of a camera, in front of the world and say, I'm recommending this policy, but there's not very good evidence. It's probably uncomfortable to say that. I get that.
But it may be also equally uncomfortable to hear that, and you think that,
sure.
Again, that was when you think back early in the pandemic, when it's eating its way through the nursing homes, when the headlines are talking about the 1,000 people, the 2,000 people, the 3,000 people that are dying on a daily basis from this, then the government wants to project certainty and calm. And I think that interfered with communicating on this issue. And it certainly would have been easy even 2-3 weeks into the process when they started seeing other data to reformulate their opinion. But I think that they continue to want to project a certainty that was not there, and therefore have demonstrated an incompetence in terms of how they talk to the public. They just don't trust. They don't trust the public to understand things. I think that's one of the real problems.
I would agree with that. And I think that is a major mistake that a lot of people make when they're interacting with the public on some of these issues, And it's certainly true, like the finer points of statistics or epidemiology, most people aren't going to embrace that or understand it. But if you were to communicate to them, look, this is a precautionary measure. It might make it might have a small effect, or it might have a large effect. It might be your great grandfather that doesn't get sick because of masking or something like that. I think that would have been reasonable messaging. And again, the 2020 hindsight thing, totally sympathetic to that. And I think we could talk all day about messaging screw ups, Chuck. But I just wanted to point those few things out. I think there's the way we talk about this, it's become sort of a, if you accept masks, you're a pro-science person. And if you're anti-mask, well, you're one of those nutters that thinks people should take ivermectin like it's a multivitamin and I don't have to listen to you. And I think that has very much polluted the conversation about what the evidence actually shows.
Yes. Everybody's gone to their corner and taken their position, and that's that.
There you go. And interestingly, that's a pleasant transition right into your story, Dr. Dinerstein. So tell us about the misinformation about misinformation.
Well, we all talk about, how misinformation is destroying things. It was misinformation that led to the defeat or to the election of the president in 2016 and 2020. You can choose whichever side you want. It was always misinformation that caused it. Misinformation has turned out to be probably the strongest thing on the planet. It is, falsehoods are way ahead of truth at this point. At least that's the common sense narrative that's being put forward. And so I was drawn to this study that wanted to look and see whether there was something underlying this fear of misinformation. And the study begins by pointing out that the fear of misinformation is a real concern to a large portion of the population. And, over 50% of the people are concerned that misinformation gets around. So they went and they wanted to look and see whether there were any psychological factors in the people that had these fears that seemed to be driving their concerns more. Were these people against technology? The modern day Luddites, they don't like any of these newfangled things. Were these people that tended to view the world through a very simple lens, that there were cut and dried solutions and understandings to all problems, that nothing was really complex? Did they believe that the world was inherently dangerous, that Darwinian concept of, tooth and claw? And then they were also looking whether these people were concerned that their friends might be susceptible to misinformation. And finally, they looked at how confident these individuals were that they could identify misinformation and separate false from true. And as it turns out, it's this last quality, what they termed the third person effect, that the tendency to be more confident in oneself compared to others in identifying misinformation was the greatest factor in those that were fearful of misinformation. And it's kind of what is described as the Dunning-Kruger effect, that, you're overconfident in your abilities. When you ask a group of people in a room what their IQ is, it doesn't pan out that everybody thinks they're average. Everybody's at 120 or 130 points. We're all smarter than we think we are. But it was interesting for me to see that it was that same kind of confidence that drove people to be fearful of misinformation. And more importantly, these were the people that were the Paul Reveres running around telling everybody, here was misinformation, trying to alert the people that wouldn't understand it, that the problem existed, and thereby amplifying it. To put it in a simple way, it's been our family motto for generations now, unfortunately, which is often wrong, never in doubt.
That is a very amusing conclusion that they reached. And I've noticed it anecdotally throughout the pandemic, and I've written a little bit about this, Chuck, and I think you've made the same observation in some of your stories, that there's a lot of people, especially, people who write for CNN.com for a living, or people that are talking heads on Fox or MSNBC or what have you. They tend to be very confident in what they're saying, but as we at ACSH know very well, they get the facts wrong quite a bit. So you might get a reporter for CNN that says, misinformation is a crippling problem and it's really going to threaten our democracy, this and that, blah, 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 blah. And then they'll turn around the next day and they'll write a glowing article about environmental working groups' dirty dozen list of vegetables and fruits supposedly contaminated with pesticides. And they don't see any contradiction or any awkwardness in warning everyone else not to be stupid. Come on, rubes, follow the science. And then the next day, writing an article that any toxicologist would look at and say, well, this is just preposterous. Everything in your story is wrong. So what do you think's going on there to build on what you were just talking about?
Well, I think, when you talk about the journalists and you talk about the media, then fear sells. If it bleeds, it leads. Is the old saying. And interesting, I was reading a little bit about that last week in a different setting, and it spoke to the idea that gossip was very important to social groups because it helped you know who to trust and who not to trust. And I think that this is why we see so many articles that are fear-driven, because it helps us identify the dangers, or at least purports to identify the dangers in our world. And it's something that on a deep Darwinian basis, we're a little bit more attuned to. You don't, if you're grazing in the savannah, you want to know about the approach of the lion. That's the fear-driven thing. You're not so concerned about the bees flying around or the wind blowing by. So maybe, on some kind of a Darwinian basis, we're a little bit more tuned in to fear. And we see it now in our media, which that's been the case for ever and a day in terms of media. But I think it's that part about knowing better than everybody else and having to get out the word that's driving a lot of it today. Again, on both sides of the aisle, this is an apolitical cognitive process on our part. So I think that if you look at this with the people around you, you can see it come up. In fact, I just finished writing about getting caught spreading misinformation myself. And I would certainly think that I would be able to identify it. But sure enough, it wasn't a particularly scientific piece, so I don't feel bad that way. But sure enough, I got snookered and shared it. So there you are.
It's very easy to do. And I haven't done this publicly, but there's been a handful of times where I've seen an image online or a video online, and it's described as one thing, but it's actually from a different event 5 years in the past, and it has nothing to do with the topic that I was reading about. And there's been a few times where I've been like, aha, I knew it. That confirms exactly what I thought. And then I look into it a little more and I go, oh, that was right. That silly me. I should have done some homework before getting all excited about seeing this video. So everybody's affected by this. Just to say, and I think that goes to our point earlier that you're the easiest person to fool, right? Right? I'm so smart. I'm so high and mighty. Meanwhile, I believe the same silliness I accuse other people of believing. One final thing I wanted to get your take on, Chuck, before we close out the show for the day. What do you think of the idea of, I guess, both academics and journalists using misinformation as a term to keep their competition at bay? So one thing you've noticed, or you may have noticed, is that a lot of the media complaints about misinformation, they're directed at content creators on YouTube or people on social media or alternative news outlets that, especially in recent years, are competing very, very well with the legacy companies like CNN and and Fox and some of these other major news organizations, Associated Press and so forth. And then in the academic space, I think it was Science or the British Medical Journal ran a piece about this in 2021 where they were talking about researchers accusing each other of spreading misinformation because there was research money and glory and high fives from everyone to be gained by being the expert who was calling or blowing the whistle on your colleagues, so you're spreading misinformation. No, you're spreading misinformation. And so you got this sort of pitched battle between bona fide experts who were both firing shots at each other as agents of misinformation. So give me your thoughts on that as we wrap up.
That's kind of, I think, virtue signaling in a sense that, I can identify it. Again, it's the same thing. I can identify it because I'm an expert. I can identify it. And so I'm pointing it out to you, and I think this other person is using it. Misinformation is a very intent neutral word. It's less aggressive than saying they lied or they made it up. That has a different intent than misinforming. At least it does in my own mind. I don't know about yours. And, so there's maybe misinformation is a politer way of saying you're an idiot.
That's certainly possible. I mean, we haven't mentioned the D word, which is the ugly older sister, disinformation, right? So this is apparently, you attribute this to people who are deliberately spreading falsehoods, or they're doing it for, they have a profit motive for lying about a vaccine or something like that. So I don't know. It could be a politeness thing. I think whatever perspective you have, what's clear to me, at least coming out of this conversation, is that using that term, it's become a placeholder for identifying people on my team and people on the other team. And although there are indeed people who misinform and lie to the public about science, I think we use these terms as a way to hold down certain viewpoints, right? How convenient is it that your political opponents are always the ones spreading myths or disinformation? I just find that a little convenient, Chuck, as we wrap up here.
Right. That may be the social political part of talking about these things when we disagree. There's always going to be a my team, your team thing. And so I think you've hit upon something. I'm not quite sure how I would rephrase it, but I think that when you bring intent into it, that's the political part. That's when we start talking about big pharma, big food, big oil, big misinformation, big environmental, whatever it might be, is that they're misinforming because they have an intent to misinform. That's when I think that may be another piece of that same puzzle.
It's fascinating stuff. Just all of the issues we talk about are really, really interesting to me, and I'm sure to you as well, Chuck. But the way people think about those issues is also really, really striking.
Absolutely.
Just to think about how other people think.
Yeah.
It's intriguing stuff. But we're going to leave it there for this week. Thank you, as always, for joining us. If you want to get the stories we talk about, you just go to our website. It's acsh.org. Click on the subscribe tab, punch in your email address, and then 3 times a week, we'll send you the stories that we write. And the ones you read the most are the ones we talk about. So if you want to be a little more informed about what we're going to talk about, read the stories, and you'll get a little bit more out of this podcast. And with that, we are gone. Oh, and one other thing I should add. I'm back on Twitter. I find social media to be a cesspool, but it seems to be a necessary cesspool, as someone I work with once put it. So at CamJEnglish, I'm on Twitter. Chuck, you're on Twitter too, but I feel like you're even less excited.
I'm invisible on Twitter.
Okay.
No.
Okay. All right. Well, you can follow me at CamJEnglish, and if you want to follow Chuck and get his writing, it's at ACSH.org, because we publish everything through that Twitter handle. And with that, we're done. We'll see you next week for episode 40.